Are you a chiropractor that sometimes has a hard time communicating the benefits of chiropractic to a practice member or patient that either has a super high pain tolerance or super low pain tolerance? As they go through care, sometimes certain practice members are going to respond to chiropractic adjustments differently, where some people don't feel anything and other people almost get sensitive or get like feel like they've got irritation. Well, we can use some principles from the polyvagal theory to help us explain and understand what's actually going on. One of the top principles in the polyvagal theory is called neuroception. Neuroception is our surveillance system of our nervous system, which is detecting threat always in our environment. Now, sometimes what happens is when we experience trauma, whether it's physical, chemical, or emotional, it's our body almost dissociates away from our body. And I also like to think of a Marvel movie where I saw Doctor Strange actually punch Spider-Man in the chest. And in this scene, Spider-Man's soul flies outside his body. So sometimes what happens is when we experience trauma and we can't process it at that time, we dissociate from our body. The benefit of dissociating is that we don't have to experience whatever's going on at that time. The negative thing is if we don't come back to our body, we have a harder time being able to tune in to what's going on inside our body. The benefit of having good interoception, which is the goal of chiropractic care, I often say it's like on Top Gun when you have Tom Cruise and the jet. And Tom Cruise and the jet need to communicate back and forth super quickly as they're like zigzagging through the mountains. Because if the communication isn't quick and Tom Cruise isn't aware of where his actual plane is in space, they're going to hit the mountain and blow up. And so we don't want that to happen. Now, some people will have such low interoception that even when you're going through your chiropractic exam, palpating through their spine, often they don't even feel this at all. Like I'll often go down their spine, I'll say, "Can you feel the difference between this and this?" And they cannot even feel it. And so we have to be able to pre-frame to those practice members that over time, we're going to bring your brain back into your body so that we will eventually be able to feel that. And most people will totally understand that. My joke is sometimes I'm a little bit old now, but in the old days, we used to watch a movie called Monty Python, The Holy Grail. And in that, there was a scene where this person comes upon this knight and they start with a sword fight. And all of a sudden, he chops off the knight's arm and the knight says, "Keep going, let's go." And the guy's like, "Your arm's chopped off." And he's like, "No, it isn't." And he goes, "Yeah, it is." And then he says, "Oh, it's only a flesh wound." And they keep fighting. That is an instance where there's very low interoception. Now, temporarily, that's very good. So if you're in a fight or something like that, it will shut off our pain response so that we can survive in that moment. But long term for healing, it's not going to be ideal. Once person's under chiropractic care and we slowly start to increase that interoception, now when a practice member comes into the office, sometimes the way they explain what they're feeling gives us as a chiropractor a huge amount of information. They'll come in and they'll say, "Well, it feels like my SI is like raised up on this side and my hip is rotated in and my shoulders rotated in and I feel torqued in my rib cage." And the funny thing is, we'll palpate through the spine and we'll find out that's exactly what it is. And so it reminds me of the movie Tommy Boy, where Tommy Boy gets smacked in the face with a 2x4. And the guy who did it was kind of apologizing. And Tommy Boy turns around and says, "Is there a mark?" And he says, "No, there's not." And then he goes, "Well, it doesn't feel so much here, or it doesn't feel so much here, but it feels right here." And that's the goal that we want with interoception is to be able to feel what's going on inside our body. Now, there's a cascade that goes neuroception, which neuroception is our detective system that's detecting the environment for danger. Then what immediately responds to neuroceptive danger is physiology, tone. So we always say tone precedes autonomics and tone precedes our interoception. And as we change our tone and our physiology, if we have good interoception, we will be able to actually determine that ourselves. We'll be able to feel that. That's even feeling, especially autonomic wise. Do we feel anxious? Do we feel tense? Do we feel warm? Do we feel calm? Like all of those feelings are more acute when we have improved interoception. And the most important thing with chiropractic is as we start to get the spine moving, the vagus nerve that goes to your brain, which is determining safety in the environment, is 80% sensory. And so if we make sure that we have safe movement in the spine, we have safe physiology, and safe cues that we're entering into the nervous system, this all allows our brain to come back and settle back into our body so that the brain-body connection works better. So I hope this helps with explaining it to your practice members. If you want any more information of it, visit our website at theinformedchiropractor.com. Until next time, have a good one.